Hello. Welcome to our virtual auditorium. Today we're going to discuss a very common form of congenital heart disease, and it's called an atrial septal defect. And I'd like to introduce you to Ed. Ed is an avatar and he will help me to explain some of the features of this condition. Now, it's really important to point out that this video isn't meant to replace the normal conversations that you would have with your child's cardiologist. It's also important to emphasize that this video should not be considered as specific advice related to your individual child. Every child is unique. Before thinking about the issues that can occur in a child with an atrial septal defect, it's probably worthwhile to do a very brief refresher on the normal heart. And so you might find it of use to look at the healthy heart video in this series. And so briefly, an important point is that the heart has two separate sides. The right side of the heart pumps blood to the lungs, and the left side of the heart pumps blood around the body. In general, there's no mixing of blood between the right and the left sides of the heart. The chambers that collect the blood that returns from the body on the right side and from the lungs on the left are called the atriums. And the wall between these two atriums is called an atrial septum. And so an atrial septal defect, therefore, is really a defect or a hole in the septum between the two atriums. Now, atrial septal defects are very common. Sometimes they occur as part of a more complex scenario. For example, tetralogy of Fallot, hypoplastic left heart syndrome, or transposition of the great arteries. But today, I'm not going to talk about these more complex syndromes. I just would like to consider the patient who has an atrial septal defect as their only form of congenital heart disease. So Ed is going to help me now to explain what happens in a patient with an atrial septal defect. So like any type of hole, an atrial septal defect can be big or it can be small. It can occur in different parts of the septum, and some patients can have multiple atrial septal defects. What's also fairly common, particularly in certain types of defect, is that some of the pulmonary veins, the veins coming back from the lungs, may drain abnormally, and your clinician would be looking carefully for this. The main problem which occurs in a patient who has an atrial septal defect is that blood passes across the defect from the left atrium to the right. And then in a patient with a large atrial septal defect, this large amount of extra blood flowing into the right side of the heart can put strain on the right ventricle. And also this extra blood will have to be pumped out by the right ventricle around the lungs so that there's a lot of blood flow to the lungs themselves. Now, most children with an atrial septal defect have absolutely no symptoms, and the defect is only picked up after someone hears a heart murmur, an extra sound in the heart. But even if children are usually well, we don't like to leave this extra load on the right ventricle and extra flow to the lungs for too long. And so if a defect is large and there's any evidence of strain on the right side of the heart, we like to close the defect in early childhood. Some children, though, particularly those with a small atrial septal defect, may have no evidence of significant strain on the right side of the heart, and in these children, we'll usually leave the defect alone and just observe your child in the clinic. And so if we decide to close the atrial septal defect after discussing it with you, we can do it in a number of different ways. Oftentimes we can close an atrial septal defect using what we call a transcatheter approach. In other words, your child will be given a general anesthetic. A tube will be passed from the vein in his or her leg into his or her heart and across the defect. An umbrella type device is then placed across the defect and left in place. Oftentimes, these procedures are done as day cases. Your child will go home that evening, and over time, the normal lining of the heart walls will grow over the umbrella, which is left in place. But some children are not suitable for this procedure, either because the defect is too close to the valves in the heart, or there may be an abnormality of pulmonary venous return, and sometimes there might be multiple defects in the atrial septum spaced widely apart. And in these children, the defect is closed by a cardiac surgeon. Again, under general anesthesia, the chest is opened, the patient is placed on a heart-lung machine for a short period, and a patch is sewn over the defect. This is an extremely successful type of operation, and after a few days, your child will be ready to leave the hospital. And so we hope that you found this video useful today as you discuss the ongoing management of your particular child with your cardiologist and other healthcare providers. Thank you so much for listening today.